My name is Susan Alsop, and today I'm going to teach you a little bit about other health impairments as defined under IDEA. Other health impairment is a category of disability under the Individuals with Disabilities Education Act that includes physical impairments that don't qualify as orthopedic. This is often going to serve as kind of a catch-all category for students who need accommodations who don't fit into the other categories, but we'll talk about that in a minute. So another health impairment means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment, and that also fills these two requirements. It's due to chronic or acute health problems, and it adversely affects a child's educational performance. I'll let you read through the listed health problems here, but they're not the only ones that qualify. So there's a large variety of conditions that may cause a child to be eligible for help meeting their educational and developmental needs. And these conditions are very different from each other. They have very specific needs to the disease that the child has, so it's difficult to get an overall blanket statement about what their needs are, but we'll look at some specific examples later in the presentation. So chronic health problems that are not specifically listed, just like the ones that are listed, they have to negatively affect academic performance to be eligible under IDEA. These are a couple more examples that may qualify, but it's not an extensive list. So we're going to watch this brief explanation about the role that this category serves under IDEA.
Around a lot. Other health impairment is what I like to refer to as sort of the catch-all provision of the IDEA. It's the eligibility category that when an IEP team, an individualized education program team, is trying to consider whether or not a child is eligible, very often if the child doesn't neatly fit into another eligibility category, this is the one that comes to mind. Now, the definition is quite clear, even though it's lengthy, it is clear. It's just one of those categories that is used a lot because sometimes a child just doesn't neatly fit into another definition, and so we use this one. And so I just caution parents that when you hear this term and then you read the definition, you may be a little concerned thinking, my child doesn't have any of these diagnoses, or maybe I should be more worried about this definition because of the way it reads. And I would just say it's come to be used very often as a term or as an eligibility category when we know the kid needs help, but we're not quite sure where else to put the child.
Perfect. So related services are also available for students with an OHI, and these would include medical services and access to school nurses. So these services include some things like needing special feedings and care for catheters or other medical devices, administering medications like insulin if you have diabetes, and also things like planning for the child's safety in school. Just depending on the individual's condition, there's going to be different related services that are provided, and those are determined by the child's IEP team. Children with OHIs sometimes miss school because of their health impairment, but these absences are not their fault, and so they have to be accommodated for that, and the public school is responsible for providing educational and related services to the child even when they're absent because of their health condition. So even when students are hospitalized or bound to the home, they can still receive special education because IDEA says that they can in a variety of settings. Homebound students might be assigned an instructor, which will bring them assignments, bring their completed assignments back to the school, and provide help completing the assignments. Students who are hospitalized may receive services from the hospital, depending on local guidelines from the school and the hospitals. That's sometimes available. And with the parents' permission, sometimes the hospital has to modify the IEP while they're there, and then the hospital provides the school with a summary of the child's progress when they are returned to their home. Students, when they go back to school after being homebound or hospitalized, the parents of the school staff have to plan carefully for that transition, as it can sometimes be really difficult and overwhelming. understandably, for the student. The first specific example that we'll look at is diabetes. It's quite common and usually pretty well known. So it's a disease in which the body does not produce enough insulin, or it doesn't use insulin the way that it should. The role of insulin is to convert sugar and starches and other foods into energy to be used in the body. So it's pretty important. So people who have diabetes, if they are eating regular amounts of food, they may not be getting enough sugar because the sugar can be broken down and used in the body. And this can be caused by genetic and environmental factors, and it affects about 7.8% of people in the United States. There's no cure, so people with diabetes just have to manage it, and they usually live pretty normal lives despite that. So the two types of diabetes that usually affect school-age children are type 1 and type 2. Type 1 is when the body doesn't produce enough insulin, and type 2 is when the body doesn't use insulin the right way, and it can also doesn't produce enough. So that's the most common type, is type 2. So students who have diabetes need support in managing their disease throughout the school day. That'll usually include monitoring blood glucose levels and administering insulin. And sometimes in emergencies, that means that the nurses have to be prepared to inject glucagon, which is used if the student's blood sugar levels reach a really, really low level. So diabetic students also might just need to be able to eat a snack at any time during the day to manage their blood sugar levels if they get low. For the most part, they function normally in the classroom, but sometimes they just need some extra planning for situations like standardized testing and just being able to step out of the classroom and do whatever they need to do to manage their diabetes. Also, picture like an emergency lockdown situation. There need to be a situation prepared where that student wouldn't have to go without whatever accommodations and management that they need for their disease, because that could be a medical emergency for them if they didn't have access to what they needed. So for the most part, diabetes not a huge deal in the classroom, but they do have to deal with their diabetes during the school day like every other time, and that has to be accommodated for them. The next condition that we'll look at is heart conditions. There's a lot of different heart conditions, but we're just going to look at congenital heart defects here, which are a defect that children are born with, so they happen during prenatal development. And these usually just cause the heart to not be as good as it should be at its job, which is pumping blood. So sometimes they have poor blood circulation, which can have an effect on their overall health. Sometimes these are accompanied by other medical conditions that they can develop, so it can sometimes be a complex set of diagnoses. This is pretty rare, but about 8 in 1,000 babies will be born with a congenital heart disorder. If it's a simple defect, they usually survive into adulthood and live a pretty normal life, but they may need to just be aware of their constraints physically. Some will also experience a developmental delay or other learning difficulties, which is probably when they would be placed under the category of an OHI. Children who have congenital heart defects may have limited exercise capacity, making them fatigue easily. So that can cause them to struggle a little bit with the pace of the classroom. And there's a variety of different things that can be done for that, but a lot of the time it's just things like allowing them to take tests at a later time and have extra time to complete assignments, and also sometimes supplemental instruction. But it'll be specific to their condition, which is the case for everything under an OHI because it's such a diverse category. The last category of condition that I wanted to talk about specifically is hemophilia. Hemophilia is a genetic disorder which causes the blood to not be able to clot properly because it's missing the protein that it needs to do that. So people who have hemophilia bleed a lot longer than normal people. But there's a myth, which is that if they get a small cut, they can bleed to death, which isn't true. But it does vary from severe to mild, and it usually occurs in males because it's a sex-linked disease. So children who have hemophilia who are eligible for special education usually have a severe case of the disease because usually it's pretty manageable, but this usually actually is manifest by internal bleeding, a lot of the time around the joints like the knees. So sometimes they have to stay home if they have that. And also it needs to be treated if it happens during school. So this again is usually going to be a pretty severe case, but they're just going to need accommodations for when they miss school and when they can't participate in activities or when they have a medical emergency at school. So specific needs of students are going to be really different depending on their health condition, but in general, teachers should try to be familiar with their condition and carefully follow the IEP and ask questions when they don't understand the student's needs. Usually, I would say almost always, the teacher's not going to provide medical services. That's the job of the school nurse. But they should be aware that if there's an emergency situation like a lockdown and the student needs to be attended to, somebody has to do it because that becomes a medical emergency for the student, depending on their condition. In general, teachers should be patient and understanding about these students and their conditions. Not all of them are visible or always obvious, and so teachers should understand that even if the student seems like your normal average kid, that they really do need the accommodations that they've been provided in the IEP, and the teacher should follow that. That's the end. Here's a couple of sources that we used.